Taking the bronchodilators today because most of the time the doctors want them before and after, so you wouldn't want them to have taken them that day. Have you smoked the last hour? Have you had any soda or caffeine products the last 12 to 24 hours?
We have to memorize all those questions?
Yes.
And these days, you're probably going to want to ask them about energy drinks and stuff like that, since so many people do those 5-hour energies and stuff. They may not think about that it's got caffeine in it.
You cannot practice this while I'm not here. It's very, very expensive. Somebody did last night, yesterday, already. Don't do it.
I'm sorry.
I will lock y'all out if I have to.
So
I don't want to do that.
Has
Just
to be
don't do
from the
it.
other lab that did it.
Yeah, because we haven't been in here.
Just don't do it. You attach your syringe here to this piece. You need the little rubber piece on it. If it's missing, you need to put it on there. So it connects there. This piece is very sensitive, along with very expensive, so be careful. It's ready to be calibrated. Did y'all see me hit the button where you calibrate? No. Flow sensor calibration. Okay, so then you hit F1 to start the calibration. It's going to tell you connect to the syringe. I already did that. And do room air purge 2 strokes. 2. Okay, space to continue. So now it's going to stabilize.
You said 2 strokes.
It tells you.
Oh.
You just wait till it finishes. Okay, then it takes you to this screen. So the purpose of this part of calibration is to hit all the yellow lines and try to remain in them until they turn green. So the first 2, there's one above, one below. They look like this one line, but that's actually 2. So you need to hit those 2. Then you pull a little bit harder, a little bit faster to hit these 2. Then you pull a little bit harder, a little bit faster to hit these 2. Then very hard, very fast to hit the last 2. You'll know that you succeeded when they turn green over here.
Can you just go? It doesn't matter if you go from slowest to fastest.
It doesn't, but you should go from slowest to fastest.
What's the space to continue?
So it's not going to pull up the first stroke. It lets me have one. So that's me. The black line doesn't count, and the second one I push in, it's going to be a red line on top. There it is. So I'm trying to keep it in the yellow. And then I'll have to do it again at the bottom. So I got 1 green. 2. I'm going to go ahead and finish the stroke. Now a little bit harder, a little bit faster to get that one.
You gotta get 2 green lines with your section.
Mm-hmm.
So it gives you up to 15 strokes in 5 minutes, but you want to get it in less than that. If it takes you the whole 15 strokes, then you probably need to recalibrate it. So this is the next part of calibration. Now I'm going to keep my high line in between these 2 red lines and my low line in between these 2 red lines. And try to be consistent and don't wait too long in between strokes because it'll plateau on this side. But the main thing is to kind of trace over yourself over and over.
Get your 1 free stroke.
So I'm going to try to trace over myself.
And she's tracing over there on the right. But it
like
shows
that.
up on the left also, so that you see where it's
You want to make sure they're
not
peaked
plateaued.
off. And it'll stop you when you're done. So you see how they peak and don't plateau off. If you fail, it'll tell you failed, and you will have to do it again. So if you don't get any caution signs or signals that flash up, then you're okay. So then you hit F3 to store and exit calibration. So it says store, calibration, and exit at the bottom. Okay, so then you go to new study. Here's where you enter all your patient information: patient ID, first and last name, gender, arm span if they don't have legs, height, weight, room number, physician, technician would be you, date, today's date, the patient's date of birth, the age, race, any other information, and down here in pulmonary reference you choose the NHANES 3. So it has a bunch of different ones.
Yeah, remember that from calculations way back in Haines 3.
Caucasian, African American, Hispanic. Okay, for the sake of time, because I want y'all to have time to practice, I'm not going to enter all this for 10. But
Guys,
you will have to.
guys, bring it down a notch. I'm having trouble hearing. Oh, that elevating your voice.
So then you would go to pulmonary function. So we're going to do flow volume loops, MVV, lung volumes, and single breath DLCO.
Hold on now.
You're going to start off with the flow volume loop.
Okay.
It's all in your paper.
Okay.
She doesn't have her.
I'm running out of blazer book. Blazer book.
I'm going to get out of your way now, too. Okay?
Thank you.
So you need this piece to connect your mouthpiece to.
Bliss. Show mama. What?
You hit F1 for data collection. So the biggest thing in PFT is coaching your patient. So you walk them through what you're going to do. So Tina, first you're going to breathe normally. Then when I tell you to, you're going to take a deep breath in and then blast out as hard and as fast as you can. So it'll be deep breath in and blast out as hard and as fast as you can. Keep blowing, keep blowing, keep blowing until I tell you to stop. It may feel like you're out of air, but just keep trying to blow as much as you can. Keep blowing, then I'm going to tell you to take another deep breath in, and then we'll be done. Okay. Do you have any questions? You can get them to repeat it back to you, whatever you need to do to help them to understand.
And this arm, they're going to kind of want to be whatever their height is. And you don't want to bend it up here because this is like all your sensors and the expensive stuff. But it has a joint back here and it flexes way at the back. So just kind of support it here and that'll raise it up. And then they can kind of get it to wherever they're comfortable with their mouth.
Okay, so I hit F1 to start data collection. So you just breathe normally, Tina, and it tells you start during full inhalation. So when I tell her to take a deep breath in, that's when I'm push F1. So I'm going to let her do a couple breaths. You kind of want them to kind of stabilize to where they look kind of even. Okay, and deep breath in and blast out. Keep blowing, keep blowing, keep blowing, keep blowing, keep blowing, keep going, keep going, keep going, keep going. Did I hit the right button? Yeah, keep going. Okay, big deep breath in. In. Okay.
I was like, you better.
And you're looking for that up and down red first dotted line.
Yeah.
They
have to keep blowing until they get to at least that line.
Okay.
At least. If they haven't plateaued yet, then you can let them keep blowing some more before you hit in. And then you see her nice little loop over here.
I'm the blue.
Yep. And this is her plateau over here.
What's the black one?
It's the previous one, because remember I didn't start her a new study.
But if you have your patient, it would only have their current one, and then
I didn't start her a new study for the sake of time. Okay, so you would have to do that at least 3 times, get your acceptable and repeatables like y'all learn about in class. You look up here, it gives you FVC, FEV1, FEV1, FVC ratio, FEF 2575, PEF. This fifth one here is hers.
Okay, so that was her first time doing it.
No, I don't have to
Then
read
you'll
that.
have to do F.
If
F1
I had started a new study, she would have 2, 3, 4, or 5. It just showed one.
You're just gonna
Okay,
take
yeah,
the
yeah.
0.15, make sure it's within range. She has to do another.
Right. I'm not gonna make her do it.
But
But
it's
she-
like her
you have to do at least 3
first.
Yeah, that's
Okay.
great, okay.
to get your acceptable and repeatables.
And how many acceptable?
3.
3 acceptable.
How many
2
repeatable?
repeatable. Sorry.
Okay, and how many times can you blow?
8.
Now, what happens if we don't get them after that 8? What we do with the patient?
You have to
If
go
you
to
get
the
Send
three-
them to the ER.
You have to blow.
If you get 3 acceptable and 2 repeatable, how come in class we always say repeatability is not required?
If you can't get it, then
In the 8 tries, then you can go ahead and do it with the
Yeah.
3 acceptable?
You just have to have 3 seconds.
Yeah.
so it's liked, but I mean some people just can't.
What if my patient
Do
is
it.
I'm gonna go talk to her before we do this.
No, you're not allowed to go talk to her before you do it.
Because the doctor is not gonna be in the room when this test is done. So the only thing the doctor's gonna see is how well you coached your patient or how well they did. So they're gonna judge that you took away all the bad stuff. And that's the reason that you want the best as possible when you print out your report, when the doctor reviews to figure out what's going on with them.
I was like, I'm sorry.
It does because you gotta put in all the information, and it's faster for us because Tina knows what she's doing.
Definitely
So,
I remember doing this and I felt so bad.
Did she have a
I was
group
Jordan's
meeting with the
patient, I was like,
juniors?
She said we can't talk to her.
I didn't say we were going to talk to them about this checkoff. I just said we need a group meeting.
You already got your patient?
We'll be discussing just
Do you have a
program
patient?
stuff. No, God no.
Are we
I
gonna have to
haven't
end up
met a
making
single one of the
appointments?
juniors.
Stephanie on my
Sorry.
phone.
you get 45 minutes to do this.
The
So
male
it'll
head
take
had
the
nighttime.
Yeah, it's gonna be outside class, because
I
it
think
takes
there's
so
no
long.
way it'd be pointless for me to show.
Okay, so then you hit exit, and
After
it'll
we
give
get all
you.
3 of them.
Yeah, after you do it at least 3 times, you get your acceptables and repeatables. You hit exit, it's not going to exit out, it's going to give you a list of all the other tests.
Oh,
For your
yeah, I forgot we got
convenience.
3 more to go.
Mr. Brill, what would you do if you needed, when you go to repeat it, what would you press?
So when you go to repeat it, I saved her results. So then you hit F1, data collection.
How you save the results?
It's going to pop up. I'll show you the next one.
it
It's the
doesn't-
same
yeah,
way
it's
for
just-
all of
yeah.
them. It just says store results and exit, or reject results and try again. So if you saw your patient put in good effort, it looked like they did as much as they could, then you would accept and move on.
So you need to repeat, you'll just hit F1, and you continue with that perimeter. If you're ready to go to the next test, that's when you go to exit, and it'll do a pop-down menu.
I'm gonna have to move that way. I'm just resting my arm.
So you do
'Cause
exit
it's not a good.
and move on to the MVV. It's number 2. Okay, so on the MVV, you want to make sure they have a nice, pretty staircase like this one. Not everybody's will look just like that. They usually cross like this one does. The top line crosses the bottom line. But the purpose of this is to get them to breathe hard and fast. So the people who did this last year will remember. But they breathe deep and fast, deep and fast. So Tina, you're going to breathe normally, and then when I tell you to, you're going to start breathing deep and fast. It's going to be... Okay? Do you understand? Do you have any questions? Can you repeat it back to me? All that good stuff. So, data collection, F1. To tell it I'm ready. Okay, now you start breathing normally. So you let her start breathing normally, and it tells you hit F1 during rapid breathing. So when I tell her to start breathing deep and fast, I got to hit F1. So breathe normally. Okay, start breathing deep and fast. Deep and fast, deep and fast. A little bit faster, a little bit faster. Good. Keep going, keep going, keep going, keep going. You're watching her staircase. Keep going, keep going, keep going, keep going, keep going, keep going, keep going. Almost done. Good job. Oh, you almost crossed them that time.
What if they cross? You said you always
They
cross.
usually do.
Oh, okay.
Tina's like, I'm tired.
So do they have to cross or?
I mean, if you see your patients putting in good effort, then it's nothing where you try this. You have to do it at least twice, but you can try to